Welcome back to our channel, where we share vital health tips and nutrition secrets that you need to know. Today, we're diving into the fascinating world of ginger, a spice that's been cherished for thousands of years. Known for its warming properties, ginger has been used across cultures to alleviate pain, improve circulation, and aid digestion. It boasts powerful anti-inflammatory properties and is a staple in many delicious dishes, particularly in Asian cuisine. You can even enjoy it as a soothing tea. However, while ginger is generally considered safe and beneficial for most people, it may not be the best choice for everyone. There are specific health conditions where consuming ginger could do more harm than good. So stick around as we uncover the surprising reasons why you should avoid ginger if you have certain medical issues. And remember, before making any changes to your diet, always consult with your healthcare provider, especially if these conditions apply to you. Let's get started! 1. Blood disorders. Did you know that while ginger can be a fantastic health booster, it might not be suitable for everyone? Specifically, if you have certain blood disorders, you need to steer clear of this powerful root. But why is that? Let's break it down. Ginger contains a substance called salicylate, which is somewhat similar to aspirin in how it works. This compound helps thin the blood, making it less likely to clot. For many people, this is a great benefit. It can help prevent heart attacks and strokes. However, the story takes a turn if you have blood disorders like hemophilia or von Willebrand's disease. People with these conditions have issues with blood clotting. Their bodies either lack specific clotting factors entirely or don't produce enough of them. This makes the blood less likely to clot when you get a cut or injury, leading to prolonged bleeding. Now, add ginger into the mix with its blood-thinning properties, and you have a recipe for potential danger. Imagine getting a minor cut that just won't stop bleeding. Terrifying, right? That's why understanding how ginger interacts with blood disorders is vital. For most of us, ginger's blood-thinning abilities are a plus, but for those with clotting issues, it's a different story altogether. So if you have a blood disorder, it's best to avoid ginger, and consult with your healthcare provider to find safer alternatives. 2. If you have gallstone disease. Gallstone disease is an important health issue to be aware of, especially when considering your diet. The primary function of the gallbladder is to store bile until it is needed by the intestines to help digest food. But when bile becomes concentrated over time due to an imbalance of cholesterol, calcium bilirubinate, and phospholipids, amyl stones called gallstones can form. These gallstones can lead to inflammation and severe pain, particularly when digesting fatty foods like red meat or dairy products. Now, if you have gallstones, here's why you should be cautious with ginger. Ginger, a common ingredient known for its digestive benefits, can actually trigger gallbladder attacks in some people with this condition. The naturally occurring compounds in ginger can increase bile production and cause contractions in the bile duct. This heightened activity can aggravate the symptoms of gallstone disease, leading to uncomfortable and painful episodes. So if you're dealing with gallstone disease, it's best to avoid ginger and instead focus on other dietary choices that support your health without causing additional discomfort. Always consult with your healthcare provider for personalized advice tailored to your specific condition. 3. Be cautious if you are underweight. At number 3, let's talk about why ginger might not be the best choice if you are underweight. Now, ginger is often hailed as a miracle spice for weight loss because it regulates digestive enzymes in the stomach and reduces appetite. This is great news if you're trying to shed a few pounds. Ginger also increases thermogenesis, which is the production of heat in your body, leading to a faster metabolism and more fat burning. However, this potent spice can be a double-edged sword. For those of you who are underweight or struggling to gain weight, ginger might actually work against you. Since ginger helps to curb appetite, it could make it even harder for you to consume the necessary calories you need for weight gain. Imagine trying to eat enough to gain weight, but constantly feeling full or disinterested in food. That's not a battle you want to fight. Moreover, if you are already on the lower end of your ideal weight range, consuming too much ginger could tip the scales in the wrong direction, leading to further weight loss. This can be particularly concerning because being underweight can bring its own set of health issues, such as weakened immunity, fragile bones, and fatigue. So, while ginger can be a phenomenal addition to your diet for weight management, those who are underweight may want to steer clear, or at least consult their healthcare provider before making it a regular part of their diet. Tailoring your diet to suit your specific health needs is crucial, and sometimes the most celebrated natural remedies can have unintended consequences. Keep this in mind the next time you're tempted to add a dash of ginger to your meal or drink. 4. Avoid ginger if you're on certain medications. You might love the spicy kick that ginger adds to your meals or the soothing relief it provides for nausea. But did you know it can be risky if you're on certain medications? Ginger contains powerful compounds that can interfere with how your body metabolizes various drugs, making it something to be cautious about if you're currently taking prescribed medication. Let's dive into exactly why this is important. For instance, if you're taking beta blockers for high blood pressure or angina, ginger can complicate things. Beta blockers work by preventing the body from releasing adrenaline, which is essential for controlling your heart rate. When you mix ginger with these meds, it can cause your blood pressure to drop too low or even lead to an irregular heartbeat. That's a risk nobody wants to take. But that's not all. If you're on blood thinners often prescribed to prevent clots and manage cardiovascular conditions, ginger could be a hidden danger. Blood thinners reduce the risk of strokes and heart attacks, but adding ginger to the equation can enhance the bleeding risk. Imagine a small cut turning into a bigger problem just because of an herb. And what if you're managing diabetes? Ginger can affect your blood sugar levels by stimulating the pancreas to produce more insulin. While this might sound beneficial, it can turn problematic if you're already on diabetes medication. The combination can cause your blood sugar to plummet to dangerously low levels, a condition known as hypoglycemia. So, while ginger is fantastic for a myriad of health reasons, it's not a one-size-fits-all solution. Always consult your doctor before adding it to your diet if you're on medication. Safety first always! 5. If you're pregnant and have a history of miscarriage or premature labor. So, ginger, it's this amazing root that's commonly touted for its incredible health benefits. Many of us know it's a go-to remedy for an upset stomach and nausea. It's pretty effective in aiding digestion and improving saliva flow, which can make it your best friend during a bout of morning sickness. However, if you're pregnant, you need to tread carefully with ginger. Here's the deal. While fresh ginger can certainly offer relief from nausea and morning sickness after a few days, consuming it in high doses during pregnancy could potentially lead to something far more serious like premature labor. That's something nobody wants to risk. And it's not just fresh ginger. Dry ginger root, or ginger supplements, are often packed with high concentrations of ginger extract, and they can be particularly problematic. For these reasons, if you're expecting and have a history of miscarriage or premature labor, ginger might not be the right remedy for you. It's crucial to have a chat with your doctor before adding ginger to your diet during pregnancy. Your doctor can help you explore other alternatives that might be safer and more suitable for your situation. Remember, while ginger is beneficial and safe for most people with a daily intake of up to 4 grams, it's not a one-size-fits-all solution. If you fall into the category of those at risk due to its potential negative effects, then avoiding it might be your best bet. In conclusion, while ginger offers a plethora of health benefits ranging from digestive aid to anti-inflammatory properties, it's essential to recognize that it may not be suitable for everyone. Whether you're underweight, on specific medications, or experiencing a delicate pregnancy, incorporating ginger into your diet without caution could lead to unintended health risks. Always tailor your dietary choices to your personal health needs and consult with healthcare providers when in doubt. What are your thoughts on the pros and cons of adding ginger to your diet? Have you experienced any surprising effects from using ginger? We'd love to hear your experiences and thoughts in the comments below. Don't forget to like this video and subscribe to our YouTube channel for more health tips and information. Stay healthy and informed.